Okay.
Good morning, everyone, and welcome to our November Security Health Plan Academy webinar. We appreciate you joining us on this brisk November day. Today, we are discussing health literacy, its significance, and how informed decision-making leads to better health outcomes. Today, you'll gain practical tips on asking the right questions, utilizing trusted resources like the WebMD portal, and ensuring you'll understand medical information through the teach back method. Leading today's session is Security Health Plan Wellness Specialist Bronson Stelzer. Bronson earned a bachelor's degree in exercise science from the University of Wisconsin-La Crosse. He has extensive experience as a health and wellness professional, including personal training and spin instruction. So without further ado, Bronson, the floor is now yours. Let's get started.
Awesome. Well, thank you all for being here today, and thank you for the wonderful introduction. And as Ashley mentioned, today we're going to dive into a topic that touches all of our lives, health literacy. So health literacy isn't just about reading medical terms or understanding a prescription label. It's about empowering yourself to make informed decisions, to take control of your health, and live the best life possible. So imagine knowing exactly what to ask your doctor, or confidently managing a chronic condition like diabetes, or spotting misinformation online before it causes potential harm. These are just some of the ways that health literacy can positively impact your life. So think about it like this. The more you know, the more power you have. So with the right information, you can catch potential health problems, avoid costly mistakes like medication errors, and reduce stress that often comes with managing medical care. So whether it's reading food labels to make smarter choices or understand why certain treatments are recommended, health literacy will help you lead a healthier and more independent life. But here's the good news, right? So you don't have to be a doctor or a health expert to improve your health literacy. Small intentional steps like asking better questions at your appointments or using online trusted tools and advocating for yourself can make a huge difference. So today we're going to explore what health literacy really means and why it's essential and how you can make simple, practical changes starting now. And then whether you're managing your own health or supporting a loved one or just trying to navigate the healthcare system. This information is for everyone. So let's get started on this journey and become more informed about health literacy and how it can create that confidence and control of your health. So today you'll learn what health literacy is and why it matters. And then how health literacy affects your health, improvements you can make, utilizing the WebMD portal, and then common challenges and solutions. And then finally, becoming your own health advocate. So what is health literacy? So health literacy is your ability to find, understand, and use useful health information. It means being able to read instructions from your doctor or understand medicine labels and making the best decisions for your health. So why this is important? Because the more information you're able to gain, the more likely you're able to stay healthy and manage your medical conditions and avoid unnecessary medical visits. So why does health literacy matter? So better understanding, to know how to take medications correctly and follow your doctor's advice. Obviously, all our time is valuable, and when we spend time utilizing the doctor's visits or utilizing medications or whatever it may be that you're following, it's important that you follow those instructions correctly to get a better understanding of what it may be to live your best life and use that information to propel and create that best life for yourself. And then confidence. So feel more confident in asking questions during the doctor's visits. Like, trust me, going into the doctor can certainly be a daunting task, And it can be overwhelming at times. A lot of us go into it feeling excited, maybe a little anxiety, but it's good to have that confidence to ask those questions in the visit so you get everything that you're wondering about or may want to gain more information done during that visit. And there's some tips and ideas of how you can create that. And we'll touch a little bit more of it in the next slides. But it can be simple as being prepared for your doctor's visit. If it's writing down questions or it's having a list of information that you can provide your doctor or practitioner during that visit. Because I'm guilty of it myself. I've gone into doctor visits. I've thought I did everything that I was supposed to and asked the correct questions. I get out to my vehicle and I go, dang it, I forgot to ask that question or I forgot to bring up this topic. So being confident in asking those questions and being prepared will help you create the outcome that you're looking for at the end of the day after your visit's done. Okay. And then prevention. So learn how to prevent disease by making informed choices about food, exercise, and medical care. Life is a lot easier if you're able to prevent things. So if you do give yourself that education, that information, like you are your best investment, so definitely take time to understand, what is healthy eating? What is exercise? And what type of medical care is best for myself? If you put those all in place in your daily routine or daily life, you're going to create a better outcome potentially in your future. So definitely invest into yourself and invest into educating yourself of what you can do to be that best version of yourself. And then if needed, managing chronic conditions. So if you do have to manage a chronic condition like diabetes or high blood pressure, more effectively, the more you know and the more you understand with health literacy, the better off you're going to be able to manage that chronic condition and then obviously improve that outcome of life with that condition. So health literacy in you. So how does health literacy affect your health? So medication mistakes, that is probably one of the number one thing that individuals run into is medication mistakes and how and when to take them. Obviously, it's super important not to have errors when it comes to your medications. So be very upfront with your doctor and provider that obviously they should give you a list of information of what the medication is and how to take it and whatnot. But go over that with your doctor and provider or nurse and ask for that clarification so you fully understand what and how to take your medications. And then avoid confusion about medical instructions. So, misunderstanding the doctor's orders might cause delay in treatment or potentially worsen your health problems. So, it's very, very vital again, just ask for clarity. This is your time with your doctor and during your visit. So, just make sure that you have an understanding. Again, that might be your preparation of coming into the appointment where all those questions are going to be asked and hopefully they'll be answered, or if they won't be answered at that time, they'll be answered later on as well. But you want to leave that appointment having that understanding of all of the instructions that I need to do. So I am my best version of myself the moment I leave that doctor's visit. And then overuse of emergency services, right? So when health information is confusing, you may end up in the ER for issues that could potentially be managed at home. So it is, again, just being a steward of your own health, an advocate, as we'll touch later on here in the presentation, but have that understanding of what I need to do to understand my own conditions and how I can make sure that I'm doing every single thing day in and day out to potentially avoid any type of issues like I just mentioned. So how to improve your health literacy? So ask questions, right? Like I mentioned before, your time is valuable. It's important that you use that time with your doctor, even if it does seem rushed. Don't be afraid to ask those questions. And if you ask them and you don't fully understand, ask again in simpler terms or have them kind of repeat themselves as well. Okay. And then use trusted resources. So using reliable websites like our WebMD portal to research health information and avoid misinformation from unverified sources. We live in a crazy technology era right now where everything is at our fingertips. good and bad. Like we can definitely educate ourselves with proper information from the right sources, but we can also be misled from information from other sources. So really, really be cognizant of where that information came from. Okay. If it's on social media or if it's on a blog or if it's on some type of forum, maybe just do even more research on it to make sure that information you gain from that resource is viable. Okay. Government websites, WebMD, or even your hospital or medical facility website is probably the first ones that I would look into and put faith into as far as the information that you need to gain. Okay. Now take notes, right? There's nothing wrong with taking notes during your doctor's appointment and visit. Bring in a piece of paper, pen and paper, notepad, or if you're a tablet user, bring in your tablet or your cell phone. Jot down the important things, instructions that you went over with your doctor or provider. Yet again, it's in the high-paced lifestyle and world we live in. Sometimes we feel like we're shuffled in, shuffled out of these doctor visits. So it's important to do your due diligence during that time you have with them is to write down all the important information that you've gained during that visit. Because a lot of it is maybe coming in, coming out, coming in, coming out. And also listen when they talk. We as people tendency have ability to want to ask questions when somebody's talking to us. So we're not really fully regurgitating what the information they're talking to us. So if they are talking, your doctor or providers explaining something, fully engage into that. Listen to what they're saying. Write those things down versus trying to come up with another question while that person is talking. Okay. And that will kind of bring it back to again being prepared and have all your questions prior to the appointment. Then you don't get caught up in that type of a situation. Okay. And if you do struggle as well, highly encourage bringing someone along with your doctor's appointments or visits. It certainly helps having that friend or family member listen in on those medical visits so they can help you remember instructions, in your future and ask for clarity if they need it as well. Okay. So what is the WebMD portal? So the WebMD portal is an online tool. It provides you with easy to understand health information, and it includes trusted articles, like I mentioned before, symptom checkers, medication guides, and tons of more information that's typically at your fingertips, right? You can download it on your cell phone or tablet. Otherwise, you can pull it up on your desktop computer as well and access the WebMD portal. Okay, highly recommend that. There's a link in our presentation here that you can utilize to go to the Security Health Plan. You can do your health assessment. You can see the access to the WebMD portal and everything that it has in it. And some of those items, symptom checker. So if you are having symptoms and you're not feeling too well, you can simply log on to that WebMD portal, enter in your symptoms, and get the suggestions on what to do next. You also can search health topics, right? So learn about common conditions, treatments, and ways to stay healthy. Yet again, you are your best investment. So the time that you put into learning more about your health and your wellness, the potential of being healthier and living a healthier lifestyle goes way up. So I highly encourage people to educate themselves about what is going on in the world with health conditions, common conditions, treatments. Okay. Medical information. So you can look up medicines, understand the side effects, and also how to take them properly. So if you do have medications or medications that you're currently taking or medications that your doctor or provider has been mentioning, this is a good way to look up those medications. And then when you do have that follow-up visit with your doctor, you can have an educated conversation with them and fully understand what this medication is, when to take it, how to take it, with food, with water, etc., those types of things. Okay. And then tracking your health. So use the portal to track your progress with your treatments or health goals. So it's important to set goals as well. It could be short-term goals, long-term goals, but always seek to work towards something. Okay. It's human nature for us to fall off track on our goals, right? We could be going down one path and we're doing really well, we're exercising, we're eating well, we're seeing the doctor and whatnot. Then all of a sudden we get derailed off of our goals. And it takes us a while to gain back that momentum and get back on track. So it's important to track your health goals to potentially limit those times being off track and getting back on track quicker. Okay. Because it happens, trust me. It happens to me all the time where, you know, Ashley and I were mentioning we have young kids at home. I get thrown off track all the time. So it's important for me to have goals in my mind or things that I'm currently working towards because I know when I get thrown off track, I can think about, okay, these are my goals. This is what I want to do. This is how I want to do it and get back on track. So it's not 2, 3, 4 months down the road before I get back on track on my wellness journey. Okay. Highly encourage that. So with, following up with your doctor and provider in the health literacy side of things, make health information easier to understand. Okay. So look for key points and focus on the most important information, like dosage instructions, or appointment times. Okay. So sometimes we get caught up in life and we miss appointments, and also, the dosage instructions on your medications. Just look for the key ones, focus on those, and make those the most important aspects of your life. Okay. Use visuals. So the WebMD again is going to be a great item for that. Diagrams or pictures, they can make complex information easier to grasp, right? So off the WebMD portal offers videos. If you're a visual learner, that's great. Okay, you can educate yourself on some of the videos or images that helps explain medical terms or medical conditions that you may, currently be experiencing. And it's a great tool to educate yourself. So when you go into your follow-up visits or appointments with your doctor or provider, you have that full understanding, or not full understanding, but a better understanding of what's going on and how to work together as a team with your provider to create the best outcome for you. Okay. And then speak up. So if you feel lost, or if your providers are explaining something differently, or you don't really fully understand, ask them to explain it in a different manner or simpler terms, or potentially provide materials that you can read later to fully understand, or maybe go over with that loved one that you brought to the visit and go over those materials so you can get a real understanding of what that visit consisted of and what your plan is moving forward. So common challenges and solutions, right? So what might be difficult? Medical jargon, words like hypertension or hyperglycemia certainly can be confusing. So how to overcome this, again, is just ask for plain language. Request your healthcare provider to use those simple words, like high blood pressure instead of hypertension, etc. Okay. And if there are some terms that you just fully don't understand after your visit, use that WebMD portal glossary and you can look up those medical terms and they'll explain those in everyday language for you. And then the teach back method. This is a great way to get clarity. So make sure that you fully understand what your health instructions are, that teach back method. This is how you explain yourself to your doctor or provider what you've been or what to expect in your own words. So, for example, after your doctor explains how to take a new medication, you simply say, yeah, let me make sure I have this right. So I take one pill of food in the morning, correct? And then your doctor or provider will say, yes, exactly. One pill in the morning of food, correct. Okay. It just helps clarify any confusion right away. And then health literacy and self-advocacy. So be your own health advocate, right? So take control. Health literacy gives you the power to ask questions and to make decisions about your own healthcare. Okay. Be prepared for those appointments, write down those questions ahead of time, and bring those back into your doctor's office. And then staying engaged. So use that WebMD portal to research conditions, treatments, and prevention strategies to stay informed between your appointments. And then get started with the WebMD portal. Okay. So, oh, can you guys hear me okay?
Yep, we can
Uh,
still hear you.
Okay, I just had some
Mhm.
background. Okay, so getting started with your WebMD portal, you can simply log on to securityhealthplan.org and you can go to the wellness page and the health assessment. Okay, you can take your own health assessment, which is a great tool. I highly recommend people utilizing that. You'll be prompted to create your WebMD account through that, but from there you can explore tools, check out that symptom checker, medication lookup, condition summaries. You can save articles, those track symptoms, and then access your personal information. So it's a good way to utilize Security Health Plan and the WebMD. So before we wrap up, just want to do 5 top takeaways of health literacy and how you can start implementing these today. Okay. So these are simple but powerful steps that can truly transform your health and well-being. So number one, again, okay, kind of a broken record here. Ask questions and don't hesitate to clarify. Okay. So never feel embarrassed to ask questions to your doctor or nurse, for that clarification. Just remember it's your health and you deserve to fully understand what your options are. And that good phrase can be, can you explain this in simpler terms? Or what are the pros and cons of this treatment? So let's start today. So at your next appointment, prepare at least one question about your treatment or condition. Okay. And then 2, use trusted resources to avoid misinformation. So, like I mentioned before, the internet is full of misleading information. Stick with those reliable sources like WebMD, government health sites, or hospital websites. Avoid those random blogs or forums for that medical advice. Okay. So let's again start today. Maybe when you look up your WebMD or log on, bookmark 2 or 3 reliable health websites and use those as your go-to resources for your health questions. Okay. And then 3 is write down or bring a support person. So whether it's jotting down symptoms before an appointment or taking notes during that doctor's visit, it ensures that you don't forget those important details. Okay. And then also bringing someone with you can provide those extra ears to catch something that you potentially missed. So again, let's start today. Create that dedicated health notebook or use your phone to record questions or symptoms or checkers that you can bring with you to all your appointments. And then 4, using tools like WebMD to stay informed. Okay. So WebMD offers, again, those symptom checkers, medication guides, other resources to utilize and manage your healthcare. So again, let's start today. Sign up for an account on the WebMD portal. Explore one feature like the symptom checker or medication lookups. And then number 5, the last tip, practice that self-advocacy in your healthcare. So you are your most important advocate for your health. This means preparing for appointments, speaking up about concerns, and making decisions that align with your values and your goals. Health literacy isn't just about taking control of your health journey. It's about creating that journey. So let's start today and take one proactive step this week. So maybe it's scheduling a follow-up appointment or refilling a prescription on time or researching condition that you may be curious about. Okay. So my final words here as we wrap up, health literacy is about empowerment. It's about making sure you have the knowledge and confidence to take control of your health and make decisions that lead to a happier and healthier life. You don't have to become a health expert overnight, but small steps like asking the right questions and using reliable sources and staying informed will make a huge difference over time. So I hope you enjoyed today's session and it inspires you to take those first steps moving forward. And remember, the journey to health starts with you and the understanding of how to control your own health. So thank you for your time and participation. And now, if you guys have any questions, certainly this is a great time to bring them up and I'll open up the floor for questions.
Yeah, thank you so much, Bronson, for that
Mhm.
presentation. I do have one that I'd like to ask while we're waiting for other questions to come through.
Yeah.
This one was submitted in advance and it reads, because doctors are allowed to give their patients such a small amount of time for their appointments, please address how to best get the best bang for your buck. I like to get my questions answered, but I don't want to get my doctor in trouble for taking too much time with me.
Yeah. So it is a very common question and a very common concern in today's world. First off, and first most, just understand that your doctor and provider are people as well. And sometimes their day is not dictated by their own personal choice. appointment times obviously certainly can seem quick, and especially when you have a lot of questions or concerns to be addressed during that time. So even just practicing empathy and understanding with your doctor or provider might create a better relationship going in, and then also dissipates that anxiety of asking those questions. So first off and first most is that being prepared for the appointment, right? So having those questions, jot them down, even simply walking in and maybe giving them to your nurse or provider to maybe hand to your doctor prior to the appointment is a great first step, or before your doctor comes in. And if that's not an option, just simply bring those questions, hand them into your doctor, or make sure that you're asking those questions in a timely manner. Now, don't come in with 50 questions. Maybe it's five, okay, or three. Just those ones that are probably most pertinent that you can get the clarity and information on. So that way, when you leave the appointment, you feel confident knowing that those questions were answered and your healthcare is going to be at optimal moving forward, and you can work on those things once the appointment's completed.